Hello, I'm Dr. Andrew Safer with Carolina Foot Specialists, and we're a little less than 2 weeks away from the bridge run, and I hope your training is going really well. What I'd like to talk about today are some tips on proper running form as you tackle the very intimidating incline portion of the bridge, as well as talk about one of the more common heel pain conditions that I see with incline running, which is Achilles tendinopathy. So we recorded my sister-in-law, Danny Greenberg, on the treadmill. She's a very experienced marathon runner. And I'd like to show you how her excellent running form can hopefully make it easier for you as you run on the bridge and hopefully avoid potential injury. So I'm going to move the camera over to the first video showing Danny's foot positioning. And as you can see on this video, Danny's taking smaller steps and strides as she runs on the incline, which makes her very efficient as she runs. Taking longer strides will definitely cover more ground, but will really tire you out much quicker. So really focusing in on the smaller strides will make it a lot easier for you as you go up the incline portion of the bridge. As we look at the second video, this is really focusing in on Danny's posture. As you can see, Danny has a very straight body alignment. She has a slight forward lean into the incline of the treadmill. And some of the problems that can occur is when you lean too much forward or hunched over, which can definitely cause some issues such as straining of the Achilles tendon, as well as increased pressures to the balls of the feet. Another factor that I see that's excellent with Danny's running form is her shoulders are back, her chest is out, and she's looking forward, her neck is straight. She's not looking down. And this type of positioning will increase optimal breathing and not make her as tired as she runs on the incline of the treadmill. So hopefully these tips will help you as you run on the bridge, and I want to just thank Danny for allowing us to videotape her on the treadmill. So what I briefly would like to talk about is Achilles tendinopathy. Structurally, the Achilles tendon's fibers inserts onto the back of the heel bone. And the majority of patients that we see that have heel pain is usually, as far as the Achilles is concerned, is right at the insertional point. And it's not so much an inflammation of the Achilles tendon, but it's more of an overstrain or more of an overload of the Achilles that caused the issue. And I would say the number one culprit, without a doubt, is running through the pain, which is very, very common. And that's very important not to do that. So trying to recognize this Achilles tendon pain early is very key, and we'll talk about some ways that it can decrease some of that pain if you are experiencing that during your running. Another cause could be overuse. A lot of times you might not have as much time over the past couple of months to run the bridge, and you're really ramping up your running over the past couple of weeks and days, and that can really cause a major overload and strain of the Achilles tendon, and really can cause some, at times, really debilitating pain. So you have to be very careful of that. And lastly is shoe gear. You want to make sure that your running shoes are current. If they're older than a year, that can really contribute to all sorts of foot pain as well as heel pain. In addition to that, you want to make sure your running shoe does not have too much cushion, which can definitely further strain that Achilles tendon. So if you have Achilles tendinopathy, how do you treat it? Well, there's definitely hope. And so the first way to treat it is really mechanically. And one recommendation would be the incorporation of a little bit of a heel lift. If you add a little bit of heel lift to the back of your shoe, that will raise up that heel a little bit and help to take off a lot of strain of the Achilles tendon. Another treatment would be if you have excessive flattening of your arch, or what we call overpronation. Sometimes incorporating an over-the-counter or custom foot orthotic can help to control that pronation and help to decrease that strain on the Achilles tendon. Lastly is stretching, and Dr. Brown talked about this last week, and I'm a firm believer as well. Really decreasing the amount of stretching is key. I see a lot of patients that stretch too much, and that will not allow that tendon to properly heal. So maybe light stretching or the incorporation of a night splint at night to help stretch that Achilles as you sleep, but just be careful with overstretching. Other treatment modalities would be reducing pain and inflammation, such as ice, Epsom salt soaks, and warm water, and oral anti-inflammatories would be very helpful. Cross-training, I say that all the time in the office, is if you are experiencing running pain, maybe run in a pool, which is very low impact, or you can do cycling or yoga, or just decreasing amounts of hill running over the next few days, and maybe incorporating some of the things we're talking about in the video today may help to decrease that pain and inflammation. Another treatment modality is foam rollers. You can buy those anywhere at any sporting goods store around town. A foam roller can be used on the back of the gastrocnemius muscle, which is the calf muscle in the back of the leg, and that will definitely decrease some of the fibrous adhesions in the back of the calf muscle and maybe help with some of the pain in the Achilles tendon. So hopefully these tips on proper running form and how to recognize and treat Achilles tendinopathy will help you during the next few days and weeks up to the bridge run. We wish you a lot of luck, and we hope to see you on the bridge.